All right, President Joyce, back to you.
All right, so we will now review and discuss staff delegated authority and policy with staff member Efremov, mailing H.
Yeah, I think. Thank you, Staff Member Efremov. I will just pause while we pull up the document and share. All right, so everyone on the call should be able to see. Does Board Member Patel need to leave at 3? Oh, President Joyce, does Board Member Patel need to leave at 3 o'clock today?
Board Member Patel, is that correct?
Yeah, that's good. Thank you.
Okay.
Okay, so we may want to ask her.
So we'll note that you just let us know when you're leaving, and then I'll announce it.
Perfect. Thank you. Will do. All right, Staff Member Efremov, we are moving on to what we always refer to as the Staff Delegated Authority. It is written here as Oregon Board of Pharmacy Delegation Authority. So we are going to look at mailing H, which is up on the screen. These are standard documents that boards typically adopt to ensure that there is clear communication and delineation of functions from the board to the executive director, that the executive director can further delegate to staff as they see fit. The last time the board reviewed and approved a delegated authority was August of 2023. So it's been a little while. And you might have noticed it's changed a bit. So the most notable changes are that this document is updated to separate out both the authority from the policy. So it's clearer to understand what is the delegation of authority and then what are the guidelines or policies the board is imposing on staff or giving staff the authority to follow. So at this time, we're looking at the first document. We'll just go through this document of, Oregon Board of Pharmacy, Delegation of Authority, and we can just scroll through this if you would like and just pause for any questions, or I can do a round robin, whatever the board would like best. I'm not sure if you have a lot of questions about this. This is really just legal components, and I don't know if board legal counsel has any additional important points to share related to this.
We're like kind of like taking what we had and making it a little more user friendly, and making sure we have outlined. So basically, it's just like the way that our statute is written. It's very much like because oddly enough, the executive director used to be a board member. It's the way the statutes were originally drafted, but the executive director was an actual board member, a non-voting board member, but a board member. And so when they pulled that out and made it different, they did it in a sort of a piecemeal. Well, I wasn't there. This is based on what I see on the legislative history. It's sort of like they just like kind of changed a couple things and didn't like think through what they were doing and how they were doing it would change so much. And so basically I just tried to look exactly what was in statute that normal boards would have automatically, right? And make sure that we have given it to Gary, because I don't think it was structured before in a way that kind of thought of us in that lens. So just kind of like making sure we have everything and then taking those sort of specific policies that gives board staff the ability to do things with cases and putting it in a policy form that's a little bit easier to follow and navigate. There's no, and I don't believe maybe you want to walk on the policy side.
Yep, I will definitely walk through the policy side. There's some different points, but we're just going to scroll through this so the public can see it too. This is really just ensuring that board staff can keep doing board business. And if there's any questions, then I will just open it up if any board members have questions about the authority document. All right, hearing none, then we will move to the next document, which is the policies pursuant to board delegations. We'll pull that up. And this document has significantly been updated. So again, there's no highlights because this is all new language, even though there's some similar language, but it's all packaged in a new way. There's a creation of 4 categories. So there's disciplinary history section, criminal history section, CP audit failure section, and an inspection section. It's important to note there are some suggested changes that staff requesting the board to consider at this time. I'll highlight those as we go through. It's also us trying to take the feedback we've heard from the board over the past few meetings and to implement it within. Also important to note what is not on this document. Staff has taken into consideration the additional clarity or direction the board has provided related to the written review section. So when we have like categories, we will add those to the agenda, similar cases with the guidelines that match for those, and you can individually discuss those. They just won't be presented each time by a compliance officer, but it still will be reviewed and deliberated on by the board. We thought that it would be best not to get into the weeds of that and have a list of written reviews here. It seemed like that actually might be more limiting and not allow the flexibility. So what we can do is we will keep incorporating as we have like things into the written review section of the board agenda. So for here, we're just going to focus on what has been pretty clear guidance for quite some time, just revamping it a little bit to address some of the pain points that the board has raised. So disciplinary history, doing number 1 through 5. So number 1, staff proposes that for a history of a civil penalty of $40,000 or more would require board review. Staff currently has been operating under a similar structure, though the current language allows us to write off or approve civil penalties, any civil penalty. In our experience, a civil penalty over $40,000 imposed by another board is likely due to some severity within a case. So we would feel more comfortable if that would warrant board review, since we are typically doing that already. This is also to note that staff could be more conservative than this too, right? This is just what the board is giving us the ability to authorize, but there are situations where something might just not feel right. We're going to bring it back to the board anyway. So we do err on the side of caution. The second and third bullet points add additional qualifying language for the to include not only reprimand, but letter of admonishment, CPE training, other similar low-level discipline. So we would propose to still allow staff to approve applications for licensure for those situations. Fourth and fifth bullet point are new. Staff is requesting the addition of these sections to account for someone has completed their probation. So currently, probation requires board review and a CR case. We would like to propose that if someone has completed probation and they have their license reinstated, or there are no additional restrictions onto that license or registration, that staff could issue that license. Same thing with the denial of a licensure. Some states, depending on how they operate, deny then issue the license. So we would like the ability to, if someone has had a denial, but their license or registration issued to that entity from that state, that would disciplinary action would be able to be assessed and to be approved for staff if they do have that license now without any additional parameters. And sorry, it's 6th bullet point. Do you mind maybe scrolling down? Sorry, as we're going through this. And the rationale for this too is to really ensure that we are granting licenses for those individuals that are likely the board is going to grant anyway. We don't want to have additional time or barriers for those to get licensure that are not necessary. And we do understand that this has to deal with people's livelihoods. So we really are trying to license people as expeditiously as possible. So the 6th bullet point.
6. 1, 2, 3.
Well, I did say I would stop at 5, didn't
That's
you?
5. Denial
1
is
through
number
5.
5. Okay. Are you at if an applicant? Are you at the main bullet?
That is an interesting point now that you say that.
Are we missing something?
I don't know. Give me 1 second.
Did you speak to that?
Oh, I'm all on number 1. I lied. I'm talking about bullet points. Thank you. So the 6th bullet point on number 1 is similar language, but actually a bit broader than the current language because it'll still incorporate other serious concerns like active probation, surrenders, suspensions, denials, and revocations. So that's for number 1. It's all in there.
Okay.
So for number 2, this is for licensees only. So we kind of split this up and it's within the board's current SDA. So it's previously compliance number 4. There's not changes to the content, just the structure. For number 3.
Oh, skipping all these bullets, going down.
Same thing.
I had a question.
Oh, yep. You want to go ahead?
Sorry, it's probably just me, but number 2, I was just confused by the first bullet point where it mentions first bullet point. But if the disciplinary action falls under the first bullet,
Of number 1.
Meaning,
So it would be approve issuance of license of registrant or take action when no disciplinary report has as followed. So it's all of bullet 1. So can you scroll down so I can read it all really quick? So it is saying if disciplinary action falls under the first bullet point of number 1, the case will be placed in a written review section with this discipline if they failed to disclose it. So this means that those actions do not require CR review. So all that would be contemplated here is their failure to disclose, because if they disclosed, then there wouldn't be discipline proposed. Does that make sense? Sorry, it's kind of hard to structure
Just
this.
the way it's, yeah, it'd be nice if it was numbered or something better.
Okay, we could do that.
Just A.
We could do sub A's and then, yeah, we could number it like rules and then,
That's the same. I thought about
Mhm.
another one too.
yep, they all refer back to that. Because we're looking at that part as being the carve out that we could just issue a license for people in those circumstances. So we're trying to say that there's no additional other than they just failed to disclose. So that would be the only thing we're looking at, but I love that recommendation. We could definitely make that update so that it is clear if it's like 1A, whatever the next would be, big A through C, D, E, F, whatever's right there. Thank you. That is helpful. Any other questions or discussion on paren 2 or 1 or? Paren 3 is new and is for registrants specifically. Staff noticed there was oversight and for some reason licensees were accounted for, but registrants were not. So at this time we were proposing to add this. It is important to note the board has deliberated differently on this one, at times providing a notice for 2,500 and others a 10,000. Staff was trying to be more consistent and proportionate at how you compare people and places. So if it's 1,000 for people, we thought likely 10 for an outlet makes the most sense, but wanted to let the board know this is new and open to whatever board direction you would like on this. And it's just going to mirror the licensee language, but yeah, if you can pause on this one for a second so everyone could read this. And same adjustments we can make on, instead of first bullet point of 1, we'll have clarity of what that is related to restructure.
Everywhere. It'd be in the next bullet point too. Okay, I'll highlight them for you.
And then number 4 is to mirror what is saying in current number 7 that is approved in SDA. So it just adds the language from the new proposed one. So we're clearly saying that if it's under these conditions, so it's the same concept as what is already approved, just incorporating the new additions if the board is comfortable with the new number 1. Sorry, there's not like a super easy way to explain all this stuff. And then number 5 is a new item. Staff proposes to add this item for clarity. The application requests that all disciplinary action be provided, as all the history may be important and relevant, but we want to allot for the fact that there are some times when applicants have disclosed their history on a previous application, but forgot to provide it on the newest application. So our internal process is when someone discloses a history, we document that in our system. So if when we receive an application, we see an applicant has disclosed it on a previous application, we want to be able to give them credit for that and not have to take any further action. And I will pause again. I know this is a lot to absorb in a very different structure, so please, suggestions, recommendations, changes, all very open to. And maybe I would ask Board Member Patel, I know you need to sign off soon. Is there anything important that you would like to convey about this before you have to step off, or any aspects of this at all?
So far, so no. So far,
Okay. Okay, we will move to the next section then. I think everyone might be a little tired too, as am I. So criminal history. So this is going to mirror what we just went through with disciplinary, but this is again with criminal history. So number 6 is within the current direction of the approved SDA 3. just restructured with the language. Number 7 is in relation to when an application discloses their criminal history. And we've added detail per AAG Vice to ensure that any cases or convictions are completed. So adding that clarity of not only is it not a felony, but the conviction, but the case is complete. So they don't still have something out there pending with their courts they might not be compliant with. Number 8 combines current approved SDA numbers 4 and 7 and just puts them in the same section. Number 9 is the same parameter that was in paren 5. Number 10 is similar to the previously disclosed disciplinary action that's in number 5. And number 11 is a new similar one to number that we talked about in the previous section, but I will go ahead and stop. I saw a couple hands, just wanted to get all that out. What would you guys, I think I saw Kirkbride first and then Chin.
I know we've had conversations about nexus to practice. Is there a documented definition that the staff uses for concerning nexus to practice, as it's mentioned several times here?
Staff member Efremoff, no. I think the difficulty we had is we wanted to move away from does everything can have nexus, right? We don't want to say that I guess we were trying to, we work with counsel on all of these related to nexus, if something is nexus or not. I don't know. Do you want to help with this, Angie? We talked about this a lot, went round and round on the language and what the best way to approach this was.
Not overly concerned. I just want to make sure staff is approaching it consistently.
Yeah.
Since it's staff delegated authority, that the staff has a clear definition that they would be approaching it consistently.
One staff member didn't do it one way and the
Correct.
other didn't. And this is my concern is in my history on this board is that we have never considered repeated Deweys and alcohol use and things like that as a nexus because we had no avenue to send them for an evaluation that we do have after January 3rd. And so if we continue to not think of that as a nexus when most other healthcare boards do, I think we're behind the 8. I don't think we're doing our licensees or the public justice.
And I think we've had a lot of conversations about that too. And yeah, and I know like some of the cases actually that have come before you now are a little bit more kind of like looking at that and like time do we like that you hit with multiple DUIs like in a row kind of a thing, but kind of like looking at that. Also looking at the underlying conviction, like what happened, like were they at work when it happened? Were they leaving work? Were they going to work? Looking at those sorts of things. And then, I mean, the nexus component is like, I think it's always obvious when it's not there. It's not so obvious when it is there. So I think that is kind of like where we look at it on the side of like, on the obvious ones, it can not come, right? But on the non-obvious ones, then it comes. But that's still pretty vague.
I know, and staff member Efremoff, we could talk about this. So currently there's one person that reviews and does all this, and Joe does all the support backup. So there's 2 people that consistently do it the same way, and we always involve counsel related to actually when you make the comment of board member Chen about multiple DUIs timeframe, we actually do assess all of that. We always do pull counsel in related to the severity of the situation. Did they follow up with all their parameters? How many and how many years? And then we do the further investigation. Were they licensee at the time? Were they practicing at that time? So that's when we try to pull together that is potentially concerning or not. And I think in one of those situations where potentially seems easier when they're not a licensee, right? Then we know that they weren't licensed at the time of the behavior. But then if they were a licensee, but we can clearly identify that they were not working, that there potentially could be a nexus, but appears like there isn't a nexus, or instead of saying there isn't a nexus, it's not a concerning nexus, is kind of where we were trying to figure out the best terminology and a way to get there. And I hear we will continue to strive to do better on this and be more clear and make sure we're consistent and open to recommendations.
That's board member Kirkbride, that satisfies my question. And in general, I feel like the staff are conservative in this, and we see a lot of these. So I don't have any further questions.
So, Board President Joyce, it is helpful when there's documentation of whether the licensee worked that day, and it's always noted. And that, you know, obviously that would be a nexus if they worked that day. But yeah, thank you.
Board Member Chin, there are nexuses that where you don't work that day. It's just really high.
Yeah,
I know that one of the things that we were going to do, since we haven't had this role before, was that, we were gonna work with Board of Nursing and Board of Medicine who have had this. And so that you all would have some insight on, how they consider these kinds of things as when they consider it a nexus or not. And then how to use this new rule, so.
Yeah, and staff member Efremov, just for the public and everyone too, the rule we're talking about is the law that passed that gives us the ability to require evaluations, I'm assuming. And with that, that law goes in effect 1/1 of 2026. So we will need to update some rules too. So there will be further discussion for the board related to that. And we want to partner with medical and nursing board related to how they issue that process internally for them, because that really does have a lot to do with Nexus, but even more so of how to ensure that we're getting the board the right information you need to make decisions.
This is Board Member Patel. I just want to let you know I am leaving.
Thank you so much, Board Member Patel.
Bye.
we will note at 3:05 that Board Member Patel has left the meeting. Thank you. Board Member Smith, thank you.
Right, any further discussion on criminal history policy section? All right, we can always go back to the other ones. We'll just move to the CPE audit failure. So this one is quite a bit different. For number 12 and 13, staff proposes to take the current approved SDA parameter and provide clarification to those circumstances. So for number 12, it would clarify that a pharmacist must take and pass MPJ within 120 days. Meaning if you want to take it multiple times or you have opportunity, if you fail and you would like to take it again, the deadline is 120 days total, period. And then from that, if they do not pass, we will send it to the board in the other standard route that we do in the written review section. So that hopefully will help with some of the workload that the board has had related to those matters. And we also then added, which was not here, so that was the ability to take and pass the MPJ in lieu of discipline. Unfortunately, we still don't have a situation that we can mirror for technicians. There's no standardized other process, and open to if somebody knows of something that would be a good parallel, but at this time we're not aware of any. So adding that information related to the CPE failure on this standard general, how we present, if you could scroll a little bit further down for the written review section. So that's how the board has consistently motioned for guidelines related to a pharmacist. And if you scroll a little bit further, we just added the technician language on this also. I'm not sure why there's a big blank there, sorry.
Oh, I see why, because it's a table. Let's just shut down.
Okay,
Hold on. Here you go.
I'm going to pause if there's questions and discussions.
Board Member Hall, might not have a popular opinion, but I was just curious if any other board members thought that this was a little bit of an extreme requirement to take the MPJE again if you missed one CE credit. I mean, I understand we all know what we're supposed to be doing and it's just one credit. I don't know.
Staff member Efremov, I just wanted to do one point of clarification too. This is in lieu of discipline. So if they fail to miss one, they're not required to take the MPJE. They are given the offer to take and pass it in lieu of discipline. Does that make sense? Okay, sorry. Yep. And I think this is the only in lieu of discipline option the board has for anything potentially.
Did you want me to go back?
Oh, sorry, I didn't know. Was there,
Sorry.
that clarify, board member Hall, then is that okay? I wasn't sure that it was looking like we were requiring MPJ. Okay, gotcha. Thank you. Sorry, maybe we could work on the language there to make sure that that is clear too.
Just didn't read it enough.
And then the last section is the inspection section. So this section is largely the same as what the board has previously seen, but we did take feedback to add some clarifying language and or changing process a bit. So this section is really about the inspection process being a very remedial, collaborative process that if there are several observations made, most of those observations can just warrant a corrective action that then would give the licensee the ability to provide that. And if it is a good corrective action, that would just go into the consent agenda, which would be to close case. So in the situation that we're looking at in 15, this is really just when it's more severe, requires more intervention or more explicit corrective action, that it would go in the case review section. So again, the board is still seeing everything. It's just how we handle and how we deal with our licensees on this matter too. And we noticed from board discussion that there were some things that probably needed to be pulled off of 15 and no longer requiring a CR. So what was added for the C2 reconciliations, we did add for clarity 3 through 5, because that is a requirement in rule now that was not at the time that the last SDA was done. But to clarify, and we tried our best to get the language of this, when it's not done at all. So this would not account for if you did it late. So we had a lot of them that were coming back in CR that were late, that the good corrective action, mitigating circumstances, the board didn't discipline in those circumstances. So we were trying to adjust that to account for where we're at, and also temperature excursions. So only when the drug is affected and dispensed, as opposed to there was a temperature excursion and it wasn't documented appropriately. Those could be handled with the other process of just corrective action and not requiring a CR review by the board. And I believe there was a small language tweak too related to, I think it was misrepresentation. We put intentional misrepresentation again, because sometimes it's not intentional, and that wouldn't be the level of this severity, could be handled in a different manner. Opening up for board discussion related to those changes or other suggested changes that should occur. Yes, Board Member Kirkbride, Vice President Kirkbride.
I see a couple things that I would prefer not to be on here, like missing the failure to complete the PIC self-inspection. I think could be delegated. I'm not sure that would be long discussion and different actions contemplated. I also
Just highlight
would
so we can see.
question, I don't know if others feel the same way, just like missing the C2 inventory, maybe could be SDA. And then scrolling down, there was one more. I don't like the word dirty. Like, I don't think the word dirty is in our rules. So can we make that kind of match up with language in our rules somehow? Or dirty environment doesn't sound professional language.
Can you just? Oh, sorry, it's right here.
I think,
Dirty environment. Where's
I
yours?
think that's all I see. Thank you.
Right there. Dirty. Staff Member Akramov, just one point of clarification. For C2s, it wasn't inventory not being done, it was reconciliation.
That's fine.
Did you want to change that? Or because it was saying it wasn't done at all. So the C2 reconciliation wasn't done at all, not that it wasn't done late or partially done.
I mean, in my mind, that could be a standard response, whatever that is, and we can discuss that. But to me, that action would have a standard response.
Propose a choice.
Yeah, it's too bad, Board Member Patel's not on this, discussion with the temp excursion. I'm sure she'd be excited. Any discussion on pick, gaps at all, like number of days?
So Staff Member Akramov, we would do those via case. So those don't come back via case. This is just what we're looking on at the time of inspection, what observations we typically see that would help us to navigate if you feel that you need to see those in a case review versus allowing staff kind of that delegated authority to say, here are the observations. They said they corrected them. It seems like a reasonable correction. It's just going to go to CA to close case because they're doing their due diligence to change their behavior, right? The system is correcting itself, hopefully, is the intention of this.
On the C2 reconciliation, don't we usually have a standard, response? I don't remember what it is, but they do get a. Okay.
We can't hear you.
Member Effermouth, typically,
Challenge, you do something.
the way the regulations are currently written, it is a PIC's responsibility. So depending on the situation, the board has done different things to the PIC for not completing it at all.
Remember, right, I just want to be clear, I'm not asking to have these removed because I don't want to do anything. I'm saying we could have a delegated authority for a certain violation or a certain fine. So yeah, that was my intention in highlighting the.
Ooh.
I can't think of any mitigating circumstances that would affect how I would address that from one person to the next that I can think of now.
Staff member Effermouth, just one point of clarity. So because anything that would be a violation would come back to the board and wouldn't be in the consent agenda, because that's potentially could be proposing discipline. So anything that you would like to assess kind of the merits of that, if it was on the consent agenda, you would have to request as part of the discussion that would be pulled into the other agenda. So it could still stay like removed from here and it could go on the consent agenda. But if you see that and you want to take action on that, it would need to be discussed and then moved into the other section if that makes sense to you. Which again, you could assess, you could remove it from here. It could still go in the corrective action format. And then if you believe it's too egregious or the corrective action doesn't meet what you would like to see it meet, you could pull that CA for further discussion and then potentially propose discipline. So again, the board can access any of these cases in the CA2 and move them if you would like them at any time. This is more about how staff tease things up for board review. The board is still reviewing everything. That's the case. Yes, please, Board Member Hall.
Member Hall, sorry, to go back to the CPE audit for technicians. I just noticed that pending no further violations for 3 years for technicians and then 6 years for pharmacists, that they renew every other year.
It should be 6. Good catch. That's what we have been doing. Thank
And
you.
the amounts, are they higher because they don't have the option to take an exam?
Staff member Effermouth, they should be the same amounts. I think they're just worded differently, like it's worded, we've had this moment, I don't know why we word it differently, but they should be the same civil penalties. The numbers are just different because they only have to do 20.
I mean,
We do 30, or you're saying the
0 to 4 costs $500 civil penalty.
Scroll up.
The box in the table.
Yep,
Pharmacists.
that's still 3 hours.
I'm in the wrong thing. Hold on. What did you tell me?
Can you just
again?
scroll up for 1 second so you
Yeah.
can look at the pharmacist one? Okay, so pharmacist box, oops, sorry, can you scroll down a little bit? Backseat driver here.
Hmm.
Okay, 0 to 4 is none, you're right. So this is a structure from 30 down and the others from 20 down in different increments. Yeah, this is a good discussion. Would you like to change up what the standard civil penalty assessment is for pharmacist versus technician? Do you mind, maybe, could you cut and paste so
Yeah,
they're side
let
by
me grab
side?
it.
That would be
This is
really
it.
helpful.
Look up.
Board Member Joyce, thank you for bringing that up. To be more equitable. The pay needs to be more
That's
equitable.
why, Board Member Hall.
No, I won't do that. But- Hold, please.
Oh, fun. It's a SharePoint. This is why it's doing that.
Yeah.
Be like the way the pharmacist. Just like the way the pharmacist one was, we could just copy
Hold on, hold
that
on.
and replace the technician one with.
But they're different numbers, so we should probably talk about it really quick to make sure it's, yeah.
They're your
Which is fine. You
steps.
could leave it like this, Rach.
Yeah,
So we
that's
can
your
see the number 0-4 is 500 for tech, 5 through 9 is 650, 10 through 14, 850. So this is completed at the time of renewal. Yep.
Zero's
Versus,
report should be none, I would propose.
So 1,752.50.
So if they haven't completed zero CVEs, they're not paying anything. I feel like that's not, I don't feel like that's right.
oh, because staff member Efremov, it's how much is stayed. So the civil penalty, it's still a notice for 1,000, but it's how much you stay. So I guess technically, yes, they would be paying nothing, but you're willing to stay at all. Wait, that seems backwards. That should be backwards.
That's why I'm confused.
So
And it's completed at the.
It is.
Makes sense. If you completed 29 of your 30 hours, you would stay 1,000 of the 1,000.
Okay, it does. Okay.
Okay. If you
Your money's
completed
gone.
19 of your 20, you would stay 1,000 of the
Can we
1,000.
get backwards?
Yeah, I do too.
If you completed 0 to 4,
age
you're
amounts.
not, we're staying. Sorry.
A proposal to amend the lower one for 0. You can maybe just like
Okay,
strike and
so
highlight
maybe
0.
to make it consistent, 1,800, 600, 0. Close to what it is, but consistent with the pharmacist.
So do you mind putting?
Do they all, do they all?
Yeah, I know,
want
but
that?
just let me
Yes,
look at it. It can change it so everybody knows what's potentially on the table.
I guess this isn't rules. We don't need strike. It could
No,
just be.
you don't need to strike. That's right. This is a whole new
$5
version.
million. Okay,
Yeah.
so it mirrors. But look, wait, 10 to 14 up here is 400. Are you guys missing something?
So be staying more for Dex.
Okay,
Which I support.
Support no one not doing their CE. Texts are no different when it comes to that is pharmacists.
Kirkbride in general, we do have some lower fines for technicians.
So staff member Efremov, is there consensus to make this augmentation for how we propose in written review when a tech fails CE audit? We are going to augment the stayed for 1,000 from 15 to 19, 800 for 10 to 14, 600 for 5 to 9, and 0 for 4 completed. It will be 0 stayed.
Yes.
For President Joyce, yeah, this is fair, and you know, in regards to fees, yeah, you know where I stand. Yeah, this looks fair.
So no one opposes this. Might be an easier way. Okay. So moving back to inspection. Oh wait, board member, how was there any other discussion?
No,
Okay, thank you. For inspections, so I hear a proposal to strike failure to complete PIC self-inspection form. We could delete it. And then if you could scroll, sorry, just a little bit, to remove C2 reconciliations as part of this. And then it would be those, if those were observations at the time of inspection, a compliance officer would have the ability to ask for corrective action. And if corrective action is sufficient, it would go in the consent agenda section as a recommendation to close case.
so we're saying strike those two and
Potentially, and we'll update
this to something else.
better language that's a little more professional related to ensuring that you're working in a sterile, in a sanitary.
sanitary.
Not in sanitary though, sanitary
That's
environment.
Wait, do you have consensus on this?
I'm waiting for consensus. They're talking. Does anyone feel uncomfortable with striking these two? Hear nothing. Any suggestions on what better languages? We're hoping to vote on this if possible. We could hold it till next meeting though, too, if the board needs more time to think about it. Any proposed language to update non-sterile or sterile compounding in something environment?
Non-compliant,
Love it.
remember Kirkbride.
Thank you. All right, changes as they're proposed here. Board Member Joyce, are you okay with these changes?
I Do we motion on this? Are you guys ready?
I just want to give so everybody's comfortable with these changes and the rest of the inspection section, there are no more questions, and maybe just to pause too, because I feel like we went through that really fast to make sure there's no other questions on other sections.
Oh, and I will undo this mess I did
Yep,
here.
let's clean it up if they're gonna propose as revised. I think sounds good.
Right.
Okay.
Yeah, I mean, SDA is a big deal, so, is there a motion to move to approve the Oregon Board of Pharmacy delegation of authority and policies version 12/2025 as revised?
So moved, board member Pino.
Is there a second? Yeah, Board Member Smith, for President Joyce, yes. For Vice President Kirkbride,
Yes.
Board Member Chen,
Yes.
Board Member Hall, Board Member Kroger,
Yes.
Board Member Pineda,
Yes.
Board Member Smith. Yes. Motion passes with Board Member Patel absent. Should we go on discussion with MPJE?
Mhm.
Board Member Kroger, I need to leave, but I'm happy to dial in and
MPJE?
if you can just unmute me on Teams. I
I
need.
need to invite you to Teams.
Yes, we would be happy to.
Publicly.
I need, it will be easier for you to be able to unmute. I'll just invite you real quick.
Thank you.
Okay.
We'll make sure you can join. Thank you so much.
Fine.
For documentation purposes. We are noting that, Board Member Kroger has left
Yeah.
and will be joining us, has left the building. It will be joining us virtually, when she has a minute.
You're just sending it to my email.
No, it has to be iPad. It has to be. I
The
can only
staff
invite
member
you to this.
Efremov, I will go ahead and start if that's okay while they're figuring out logistics.
That's great.
Okay, so as a reminder for the board,
Okay, I'm trying to
this
bring it
is a new concept that NAPP
Okay,
is
great.
doing for making a uniform multi-state pharmacy jurisprudence content timeline. Do you need a second?
We're not sure.
Don't
the
you have to
public
take
is-
our iPads?
Yes, and your charger.
Okay.
Oh, nice try.
Please, I don't have the charger. Board Member Tomato, you're hired.
Okay, I will.
Your gold star, Board Member Benito.
Charger?
Thank you.
I can see that charger.
I just had to keep reminding myself to don't hack it up.
Sorry, Bree, just give it a second, please.
Yeah, I'm so
We
sorry.
weren't prepared for that. I did really.
Thank you, it does. We need hold music. Anyone like to provide some?
Blessing.
Just text me.
Okay, we'll do.
Okay, so the board might remember, we had asked if the board was interested in going this route. So we would no longer be a state-specific MPJE and would potentially look into using the uniform MPJE. So this is just some additional information that we had gotten from MPJE. This is all on their public website. This is really just helping you see the outline of how they pull together. It is going to be more federal questions is what they're focusing on. And so in theory, if someone is licensed in a state, the state requires the uniform MPJE. When they license in our state, if we require it, they wouldn't have to take another law exam. We would be able to use that exam. So the board said you were interested in knowing more about this and seeing if it was an option. Shout out to staff member Ball. He had done some additional work in reaching out to NABP to understand the situation to make sure that it can work for Oregon. Our biggest concern was when they write these questions, making sure that they are not in conflict with Oregon regulations, right? The worst thing we could have is our students or whoever would like to be licensed here answering questions in a way that would not be answered as a correct answer and able to pass if they were in conflict with Oregon regulations. So they had responded to us that it is a very similar process to what is currently done. So they will pull the questions, create the questions, and staff can be included in the assessment. So what we currently do, we participate in question writing and review. It appears we might not have to write anymore, which might be lovely. We would just do the review to make sure that those questions are specific and in compliance with Oregon. The other part that hopefully it'll decrease time for licensing pharmacists. Currently, there's only 5 other states using it, but there's 12 others that are looking into it. So initially, might not be a huge time-saving issue, but in the future, very much could be. I think the only other thing that we really, so from staff's assessment and how we interface with them currently, it will not cause us any additional time. If anything, it should save us some time. It should hopefully save some time for other applicants or licensees that are trying to provide service and be pharmacists or technicians. And I guess this is only pharmacists, sorry, pharmacists in Oregon. The only issue we would really need to talk about is if the board is still comfortable with going this direction, what is the lead time in changing to this? So we would potentially have to update our rules. So we would work with council to be able to update our rules to permit this and to accept the uniform MPJE. And secondarily, we would want to reach out to the schools to understand what that means for them and their law classes and who's taking tests, how they prepare for these exams, because they potentially are going to be different. So we want to make sure that we are including enough of our interested parties to know that if we make this change, there aren't unintended consequences that we're not aware of. So if you just want, you can scroll through the documents, and I believe, again, for the board, this is on NABP's public website, and I believe this was added to the board's
Last night,
Okay, so your team, so you do have access, so you can look at this more.
and it'll be in the
So
minutes.
Our goal, and it will be in the minutes afterwards. So our goal for this is really just to inform the board that it seems like, yes, this is good to go. We want to explore more. The big question was, is this in conflict or any concerns about doing this? So what we hope to get more information from interested parties and bring back to the board recommendations on how you might want to transition into using this. And again, at that time, if you decide you don't want to transition into this, that's completely fine. We don't need a formal vote today, but we just wanted to report on this. It is going to go live in June. I don't foresee us being able to utilize it at that time, but we hope that we can unveil this or enroll this out in a time frame that is appropriate for everyone to not cause too many waves or unintended consequences for other applicants or individuals in school. Questions? Please, Jim.
Which states, did you say only 5 right now?
They didn't tell us which 5, so I'm not quite sure.
On their website, they only have one listed.
We got some inside data that said there's 5 using it, but 12 are looking into it.
I see North Carolina, so, yeah.
Okay,
Somebody.
thank you.
Board Member Kirkbride, I do see some advantages, as we also have had these conversations about standard of care and our rule writing, that if we were to adopt this, for example, we would not be wanting to write rules where our standard was stricter than the federal standard. Prescription requirements and things like that, because we don't want to create more work for everybody. So that has a nice advantage, I think, that we can streamline and kind of roll into that standard of care thing if we are using a universal law exam. I do have a few concerns just around, some of the unique things in Oregon. We have a lot of unique things around pharmacist prescribing and things that are different than other states. And so if that's not on the exam, then really it is completely on the individual to, separate from taking and passing their exam, reading through all the Oregon specific rules and knowing those, without the impetus that I have to study these and memorize these for a test. And so, how successful is that going to be? I don't know. I love the idea that I'm hoping as states are adopting this, they're also saying they accept it, because I would love to see us get to a point where there is this interstate ability for pharmacists to work and respond in different situations. And so I love that. And I love that future. But, just kind of thinking through those unique things about Oregon and making sure that we feel comfortable that newly licensed people will be well versed in our rules.
Any other further comments or thoughts?
The board, you want to go ahead?
Board Member Chin, I thought there was a mention of that there would be like a shorter, possibly state-specific exam for people to take that was a lot more condensed than, and maybe I'm just smoking something.
No, I'm trying to, staff member Effermoff, I'm trying to remember. Sorry, you're obviously looking at my facial expressions. From my memory, it's just going to be more condensed, as in you won't have, it's going to have federal and state, but you won't have so much state specific stuff. They're going to try to do what incorporates for all practice, to the point that board member Kirkbride has raised.
Right.
There won't be as much specificity, I would see, or I couldn't see how there could be so much specificity related to Oregon.
I
It
understand.
would only be the overlap, and there's no other exam we would have that would be state specific.
That have a state.
Correct. This would be
specific.
transitioning away from that.
Board President Joyce, yeah, it's definitely something I would support. I think, you know, it would be up to the licensee to be up to date with the Oregon laws. But as far as uniformity and a uniform MPJE, it makes sense to me. It seems like we don't. It seems like a less restrictive way to be licensed and practicing in Oregon as a pharmacist. So
This board member Chen, it's not so much Oregon, it's being able to practice in other states.
Right.
So it's if other states adopt this, then they don't have to take the MPG, or they don't have to take their state tests everywhere they go.
more to merrier. Hopefully, it'll expand to more states.
Did want to pause too and just see if board member Kroger, I know you might be in transit, but if you had any questions or additional thoughts you would like to add to the conversation.
Board member Kroger, I'm hoping you guys can hear me.
Yep, good to
Okay,
go.
great. Yeah, no real additional comments. I think board member Kirkbride articulated them well. I am supportive of our board adopting the UPJE, and I would love for our board to be an early adopter. So thank you.
Thank you.
On this topic, we're now going to go over the HIV Alliance's request.
Yes.
Okay.
Give us just one moment to pull that up, please.
Yeah.
Thank you. I don't know. Oh, Jay. That's
Process question, board member Chen.
yes, please.
We were going to update our rule to just add one other kind of a practice provider in a list of providers. Do we have to do a rulemaking hearing and do all of that stuff?
Staff member Effermoff, I think you know the answer to that, board member Chin. No, so I thank you for beating me to the punchline here. Yes, you are familiar. You've seen these. Unfortunately, this is not in the rule priority section where we have gotten to the updating these rules to include PAs to be individuals who can have access to the key and the drug cabinet room. And these are obviously older regulations that don't account for the expansion in practice that has happened for PAs. So you have seen a very similar request before, and the board has approved it every time you have seen it. So not a lot to say here other than HIV Alliance is requesting for a PA to have access to the drug cabinet room. If you could scroll down for me, Breach, you can see the regulations there that are missing the ability to allow the PA. Scroll a little further. You see all the need, the request, and really the recommendation at this time would be to do a 5-year waiver to permit the PA to have access or a key to the drug cabinet.
This is board member Chin. We've sometimes done 10-year waivers. And is this not something that we can do as an SDA?
Staff member Effermoff, not technically. So I think there's
There was one.
there's a whole conversation about waivers. So this is a waiver request and how we do waivers and rules and how they're brought forth to the board. We would need clear criteria in an SDA of every time what it needs to be. And it also has been recommended before not to necessarily exceed 5 years because that again looks like you're saying your rules don't matter. So there are perceptions and ways, but again, this is just previous what we talked about, why we kind of landed at 5 in the past has been the standard max. And I would hope within 5 years we can get that rule updated, but I cannot promise that. And whatever the board would like to do, I'm sure we could do. If you want to make it 10, we could change it to 10. I just wanted to give you all of the information to be able to make an informed decision.
Board Member Chin, it's not that our rules don't matter, it's just that our rules are not up to date. In this particular thing, but I will go with whatever you all want.
List, but yeah, that like down.
Does anyone else have comments or concerns about this request? Go ahead. Okay, we're gonna go ahead and motion. Okay. Yeah, you're right, okay. I was just waiting on everyone to chime in. Is there a motion to move to approve the request as presented for HIV Alliance?
So moved, Board Member.
Is there a second? Board Member Smith, Board President Joyce, yes. Board Vice President Kirkbride,
Yes.
Board Member Chin,
Yes.
Board Member Hall, Board Member Kroger. Here's,
Yes.
okay. Board Member Pinedo?
Yes.
And Board Member Smith. Motion passes with Board Member Patel currently absent or absent.
Thank you.
Now,
Board Member Kirkbride, point of order, do we need to log that Board Member Kroger rejoined the meeting since she just voted?
She joined while she was still in-house, so she never left.
Thank you.
Yep.
Presidents. Now, we're gonna be discussing financial update with, Staff Member Melvin.
Staff Member Melvin, give me just a moment so I can share this with the public. And this is a revised version that I received just a short while ago from Executive Director Runyon. I'm just doing this update on his behalf. But he found an error, so I'll point it out. Give me just a moment, please.
Sure.
So this is mailing K, so I have replaced this for the board. Just so you can see this. So the first thing that we're going to look at is on the budget report would be for July, again, new biennium. So he wanted to point out what he added was highlighted in green here. So we are 16.61% under budget for that particular month. In the personal services and in services and supplies, we are under budget as well on that. Please stop me if you have any questions. I'll do my best to answer your questions. This should look familiar to you. Looks just, like every board meeting, we provide these. So for month 2, which is August, again, under budget, 16.77%. And you're probably thinking, what in the world's happening here? That is a typo, folks. So someone just, it put in the incorrect data. So the easiest way to explain this is that they put in, that looks like our entire budget for the biennium for services and supplies. So that is not correct. Yeah, let's disregard that. Let's see. And the same information you can see down below in those total columns. And I will just keep going unless you have questions. And here we are for September. Let's see. Looks like September was the one that was the issue too. So look, same issue, right? Anyways, typos. So corrected versions will be placed if they aren't already cut and pasted into this. And here's a bit of a summary for you here. He typed. So the agency is on track to the end of the biennium with a 6-month operating balance, which is what we typically have. It's above the minimum requirement. And Executive Director Runyon will continue to be diligent about analyzing these expenditure requests to ensure that we're using our resources discriminately. As of September 2025 report, the agency's total expenditures are right there for you, which is 9.76% under budget. Again, we have some savings, vacancy savings and some other things, and we have not procured our database system yet. So I've been procuring other tech things as we're kind of moving towards that, but that's a huge project. So any questions on the financial update? Sorry.
Ms. Joyce, any progress on the recruitment of a public member?
Staff Member Melvin, unfortunately, I don't have anything to report on that. It's still posted. Yes, we're going to, in January, the board will see, we have some openings coming up on our formulary committee that we're going to be pushing out in Gov Delivery. We need a pharmacist position and an APRN position is coming to term. But Executive Director Runyon could follow up with the governor's office of appointments to find out if there are any applicants. Unfortunately, I don't have any data. I haven't heard anything. So it's still open in Workday, and anyone is able to apply to it right now still. It will stay open until it's filled.
Good. Anybody else have any comments, questions? The budget? Okay. Hearing and seeing none, are you going to be,
Mm-hmm.
thinking about the strategic plan that's,
Yes. Staff member Melvin again. I would like to give the update regarding our current strategic plan that also came from Executive Director Runyon. He wanted me to let you know that the agency is compliant and continues to meet all of the set strategic initiatives by the governor. He kind of just put together a high-level update on staff's progress on implementing our 24-29 strategic plan since our last meeting in October. And he's got some noteworthy achievements and milestones he wanted me to point out. A key milestone since our last meeting, the NABP Survey of Law is an annual publication from NABP that serves as a comprehensive guide to U.S. pharmacy law for regulators, lawyers, and educators. Staff assimilated the survey contents and then underwent an extensive internal review, and then we successfully submitted it before the November 5th deadline. We successfully completed and formally submitted the proposed 5% reduction plan, which Executive Director Runyon reviewed during the October 2025 board meeting, and it was approved by the Legislative Fiscal Office and the Governor's Office. We submitted our annual performance progress report revision around the end of October with a few non-substantive revisions that were approved also by LFO. These potential revisions were also covered in his presentation during the October board meeting. He would like to thank the board for the very successful and encouraging strategic plan meeting. He's excited about the potential of creating a more streamlined iteration in late 2026. He'd also like to thank again Nicole, the executive director from the Oregon Medical Board, for volunteering her time to attend our meeting and to provide her insight and philosophy and the mechanics of the medical board's strategic plan. It's great to know we have so much support from other similar situated health professional licensing boards. Staff member Melvin worked tirelessly with EIS and an external vendor to facilitate our migration to new servers and Windows 11, and that required an extensive amount of planning, precision, and communication. I want to recognize staff member Melvin for her incredible work on this project. Well, that's very kind. I did not read this. He just said this.
She wrote.
Yes. So, let's see, the Secretary of State survey submission, something came over. The audits director of the Secretary of State sent out a survey to identify risks within agencies that is efficient, transparent, and useful to state government. The survey consists of 3 data sets that cover questions about policy governance, asset management, and IT control. Leadership team worked together to answer these questions, which also identified internal opportunities to update certain policies and procedures and processes. After reviewing their work, I made amendments where appropriate, and Gary submitted those to Secretary of State by the December 1st, 2025 deadline. The board may not know, on the operating side, we have a lot of end of calendar year deadlines. That's why he's mentioning these, because that really does take a lot of time to put these together. Okay, so key actions: drafting and adopting new rules. So in October 2025, formulary committee meeting was successful. Several different protocols were sent to the board for review during this December board meeting. We have a great group of subject matter experts, and he can't thank them enough for volunteering their time to ensure that our protocols are accurate and current. This allows Oregonians we protect to serve and obtain the care that they need via our hardworking licensees on the front lines. PPLs, we're continuing to work on those. get that presentation ready to go, potentially for the next board meeting, not the special January one, we're talking about February. The compounding rules, he made a note, he would like to commend staff member Efremov for her incredible effort and work on this rule set in order to get it ready for presentation for the December board meeting. She did this on top of all of her other duties related to the creation and the review of the substantial compliance packet. He would also like to personally thank SME Natalie Gustafson, who graciously volunteered her time and expertise to assist us in the process. This has been months and years in the making, and the positive impact on our licensees and interest parties will be significant and lasting. A criminal conviction petition that was sent to the November rulemaking hearing. We created an online form for petitioners, and they will go live on Tuesday, the 16th. I will file the rule. So the rule has to be filed first with Secretary of State. I will notice the world and all of our licensees that the rule is now in effect. I made a web page that will be in our on our website on the applicant bucket, if you will, where you apply for a new license. It'll be at the bottom of that. It's the same language that's within the form. So someone that wants to apply to that will fill out, they have to create an eGov account in My License Office, submit an application, and then that comes to the board. So that all goes into effect. Yes, Board Member Kirkbride.
Member Kirkbride, I'm curious if there's any other communication plan, not from the Board of Pharmacy necessarily, but from the state of Oregon regarding getting the word out. So like, it's great that all licensees will be noticed, but really this is more, I think, for people who are not licensees. So what I'm thinking is technician schools, pharmacy schools, state agencies who might be guiding people to certain career options. Like, is there anything the state is doing to really get out that like this exists and this might be a good avenue for some people to use as they contemplate entering this career field?
No. Staff Member Melvin, I can only speak to our database that I have access to. Maybe we could ask Executive Director Runyon and he could communicate to the board maybe in a report, but I can tell you it can go to 32,000 email subscribers that we have in our Gov delivery. I mean, this doesn't just apply just to pharmacy board, but I get what you're saying. So yes, that's a great question. I'm not sure we have anything else to add. Right, that's a statutory mandate, right? For all, Angie, is it all agencies or health related boards? I don't remember.
Be on the spot.
I know, sorry. The bill number is in the rule.
Staff Member Efremov, I think what we can do is we can follow up with ED Runyon and see if he has any different connections within the state to maybe raise this. There's a health professions regulatory group that gets together and talks about all of the overlapping requirements we have. Maybe that would be a good forum for him to discuss and see if there's anyone in the governor's office or legislature, or whoever the right people are that might have other connections for communication. So we'll carry the message forth.
Great, thank you.
But we can't confirm the process is in place and we are meeting the deadlines. Yes. So thank you to the board for adopting those rules yesterday. Okay, so in operations, Executive Director Runyon would like to acknowledge staff members Efremov and Joe Ball for single-handedly addressing a backlog of applications due to staff being out. It was over 100 and they brought it down into single digits. So he wanted to thank you for that. He also said under his direction, the licensing team have worked diligently on the backlog of wholesaler manufacturing drug distribution agent applications. The time frame for initial review has been reduced from the 6 to 8 weeks down to 2 to 3 weeks. So lots of progress there. This is a considerable achievement. He'd like to give special thanks to Licensing Director Hennigan and licensing staff Cowan. This will have a significant impact in our ability to continue meeting our goal of issuing a license or registration within that 30 days of receipt. Okay, and just a few more bullets in communication. He presented at OSPA's Pharmacy Coalition meeting on October 22nd. He hosted a meet and greet at Pacific University with exchange students at our board office on October 28th. And he gave a guest lecture to the P1 law class at OSU on November 18th. Back to you, President Joyce.
Thank you so much. So now on to the consent agenda. Right. So is there any board discussion on the consent agenda? And I am required to ask each member, President Joyce, no, Board Vice President Kirkbride,
No.
Member Chen, Board Member Hall,
No.
Board Member Kroger, are you there?
Nope. Yes, I'm here, but no comments.
Board Member Patel is absent. Board Member Pinedo?
No.
Board Member Smith? Okay, consent agenda passes with Board Member Patel absent.
Oh, no, you have to do a motion.
Oh,
Sorry.
I'm sorry.
Okay.
You are correct. Is there a motion to approve the consent agenda as proposed?
I'll move.
There's a second? Okay, all righty. Excellent. Board President Joyce, yes. Board Vice President Kirkbride.
Yes.
Board Member Chin. Board Member Hall.
Yes.
Board Member Kroger.
Yes.
Hall's absent. Board Member Pinedo. Board Member Smith. Motion passes with Board Member Patel absent. There's no public comment. All right, so we will move on to matters to be discussed. So I'll just go around and ask each board member if there are matters that you wish to state publicly. Member Kirkbride.
Thank you, Board President Joyce. During this meeting, we had several vaccine protocols that we updated and repealed, and it always brings to my mind the necessity that we are overdue for some statute changes for vaccine ages. And that is not the business of this board, but I just wanted to publicly state that our current age 7, went into place 10 years ago. And, with everything that's been happening recently with vaccines, a lot of states have been moving to make regulatory changes in the way that they approach pharmacists and vaccines. So in 2025, 8 states and District of Columbia have moved away from ACIP and CDC-based recommendations, and not just for COVID vaccine, but all vaccines. And as I reviewed those states, and Oregon is one of them, which is great. But we have the highest age out of any of those states. And I think 10 years ago, we were a little bit progressive when we went down to 7, but now here we are 10 years later. Most of those states have an age of 3, and our neighboring state to the north, Washington, is down to 6 months. And I just want to encourage that where we stand now today, that we are not using CDC and ACIP, and we are using the Western States protocol. We repealed our vaccine protocol for ages 3 to 6 because there's nothing on it anymore that we can give. The flu is covered under the flu. That really what's holding us back is that age 7. And so if there is opportunity in the future to lower that age, I think it would benefit Oregonians and help streamline vaccine practice in pharmacies. So there's not so many questions and, communication that has to happen between patients and pharmacists as far as what age can I do and why. And I just think it could be simpler if we lowered our age. Thank you.
Thank you. Board Member Smith.
Board Member Smith, no comments at this time.
Member Chin.
Member Chen would love to see us lower the age, otherwise no other issues.
Board Member Kroger.
No comments at this time. Thank you.
Board Member Pinedo.
Board Member Pinedo.
I really think that we need to revisit the definition of the practice of pharmacy. That was a big issue at our last meeting, and of who falls under what can be done in pharmacy, and seeing more cases of non-licensees practicing pharmacy and errors that are being done in a general, that's part of the law of what is the definition of the practice of pharmacy and who can that be delegated to by a pharmacist. I think that's something that we need to look at, as there's no clarity in the definition of who that refers to. And so I really think it's important that we figure that out, and just the separation between a certified and non-certified technician, that it's not required. It is not required in our state to be nationally certified as a technician. So once you get your license, you are able to be delegated anything that a pharmacist chooses that you are capable to be delegated. And I don't feel like a certified technician and a pharmacy technician are on the same level as far as education and the practice of what we do. And so I think those key points really need to be re-looked at as to what we are doing in pharmacy as we are progressing, and as the role of technicians is changing and growing, as from even just 10 years ago when they came out with who could vaccinate, and during COVID, the responsibilities that are on technicians now that were not before. I think we need to relook at what is the definition of a pharmacy technician versus a certified pharmacy technician, and where that falls under the practice of pharmacy.
Board Member Hall.
Member Hall, I don't have any comments at this time.
Board President Joyce. So there's been some, I'm hearing a lot of frustration, from several, pharmacy, colleagues and people that work in pharmacy, as far as getting clear answers from the board when they request information from the board. I know that we refer them to the rules, and that's been the practice. But I'm just passing on a message that it's been expressed that, they are frustrated with getting clear answers to specific questions. So I'm just kind of passing that on. I tell them to look on the website. And secondly, I want to echo Board Member Pinedo's statement on CPHT and national certification. Previous board member, that was a goal of hers. To strive towards national certification for technicians, and as well as myself and Board Member Pinedo, we all are striving for that because it's important. The education that someone who's nationally certified to us means you have it does lead to patient safety. I mean, you have someone that's been formally educated and has taken the test to be certified, and also within national certification, you can stratify the different jobs. You can do med reconciliation certification. You can have IV admix certification, and it's just a stepping stone to more opportunities for pharmacy technicians who want to make pharmacy technician a career. There is a high turnover rate with pharmacy techs because the pay, I know the pay isn't something that we can delegate or do much about really, but having national certification does help and lead to success for pharmacy technicians. Thank you. So I guess we are ready to adjourn. All right.
To be discussed by agenda.
Oh, okay. Anything else from agency staff?
Staff member Efmoff, I do want to give a big shout out to the board and thanks for all of the massive amount of work that you do. This is a voluntary position. Everyone might not be aware that is on this call how many thousands of pages of documentation you read, review, how you take your jobs very seriously, how you are very thoughtful in how you approach things. And I commend you on how well you do your jobs. It's not easy to sit in here for 3 days and to have that pressure, and the gravity of what you do is very heavy. And I would hope that Oregonians and licensees know that it is in very good hands. So thank you.
Thank you, and we actually appreciate the work that the compliance team has done, especially with this caseload we had this 3 days. It's been incredible, the amount of work you guys have done. All right, everybody ready? Adjourn? Okay. Is there a motion to move to adjourn the meeting at 4:04 PM?
So moved. Board Member Pinello?
Is there a second?
Board Member Smith?
Board President Joyce, yes. Board Vice President Kirkbride?
Yes.
Board Member Chin?
Yes.
Board Member Hall?
Yes.
Board Member Kroger?
Yes.
Board Patel is absent. Board Member Pineda? Board Member Smith?
Yes.
Motion passes. Meeting over. See you all next time.
I can come around and pick up if anyone took notes.
Oh.
The notes.
And
thing.
any notes you guys might have written down or on during executive session, please hand them over to staff member Melvin. Any written notes, anything electronic as well, and then to
It's fine, just.
board member Melvin, staff member
Yeah,
Melvin.
yeah.